Okay, so I'll be using this as my mother as well. So I would wash my hands and then introduce myself and be like, hi, I'm Ara Nicole, I'll be your student nurse, and I'm gonna be doing a postpartum assessment on you today. And so I'd provide privacy and I'd make sure that she does void before so I can have an accurate reading of her fundal height. And after she voids, I would explain to her what I'm doing. So I'm gonna tell her I'm gonna auscultate her lungs and cardiac, and they should be clear bilaterally. And I would check her, and then it should be the apical for 1 minute, and that should be normal. And then I would palpate each breast gently and then note the contour of the breast, and then if the breasts are full or if they're firm, tender, and even like shininess, if there are any veins distended, if like the temperature of the skin, and if ask the patient, are you having any signs of nipple soreness, and if her breasts are engorged, and then if she needs any pain medication. And then after, I would palpate her fundal height, and this is why that she needed to empty her bladder, and it should be depending on the day, it should be, the day, postpartum day, it should be under the umbilicus and then go down, each 1 finger breadth below the umbilicus every day, and check if it is firm and if it's midline, which should decrease eventually. And then I could teach her how to do self-massage techniques, and yeah. And then I would inspect her bladder and palpate the bladder, and then while checking the fundus height and seeing if they move, and there shouldn't be any bladder distension after she does empty her bladder. And then I would check her pad that she usually has, and then check for the pad, and then note the color, the odor, and the consistency of the discharge. And then I would ask how she's urinating and voiding, if there's any pain anytime when you void. And yeah, you would assess for the type of lochia on the perineal pad. So it should be very red after the first 3 days, during the first 3 days, like similar to like regular menstrual periods, and then it should become watery and serose after like the 10th day, and thin and odorless. So that's when I would document the color amount and size, odor. And then I would notify the doctor if there's any abnormal findings of the lochia. And so I would check the rectal area, which is usually, turn it to the side, and then check if there's any hemorrhoids present, and if she's like straining when she voids, because she is at risk for bleeding. And then also check for any like stitches down there, and see how they're holding up, and then when they're gonna be removed or anything. And then her bowel function. So I would check like how she's doing emotionally, ask her if she has any family support, and then note any nonverbal cues, and see if she appears to be dependent or independent, and how she's feeling about the baby, if she's happy, nervous, or anything. And then I would assess her reflexes and her brachial and patellar with the little hammer thing, And then I would assess for any edema, like on the face, and then the extremities. Then her skin integrity and how they are bilaterally, and the size and shape and the color and the turgor. And if she did have a C-section, I would check if the incision site, and then if there's a dressing, and then the color, and if there's any edema, infection, signs of infection, if there's any, what do you call it, drainage, and note the drainage, color, odor, and yeah, and if there's any pain on the incision. And then I would check if there's also any like distension, any dehiscence, anything like that. And then I would ask her if she needs anything else, and go ahead and wash my hands and document everything that I needed, and then put the bed back and put a call light and